there is clear evidence that patients benefit from feedback. But in terms of practitioners who may not be au fait with the research, most practitioners would probably argue that they value supervision above and beyond anything else. And I think ROM actually can be viewed as a kind of supervision. In other words, we don't necessarily always are aware of everything that's going around. And that's the value of supervision. Someone, a third ear, telling us, actually, were you aware of this? Did you think of that? And I think data actually works in a similar way. It provides another voice, even if it's a visual voice in some ways, of actually giving us information that otherwise we wouldn't have been aware of. Perhaps a patient not doing as well as we thought. So I think that's the value of it. And I think if practitioners just think of it as another means of supervision, then I think that eases their acceptance of it and puts it in the same sort of basket, so to speak, as supervision.
In the book, we dedicate a full chapter to the integration of routine outcome monitoring and feedback as part of clinical supervision. We outline several activities that could support a therapist's professional development. For example, activities related to role play and role play exercises so as to refine certain aspects of their practice, or exercises to interrogate their own data to learn where their skills and where their deficits may lie, which in turn then informs their professional development plan. One of the advantages of collecting routine outcome measures systematically in your own caseload is that over time you build up a very detailed database, and that can allow you to discover patterns in the data. For example, it could turn out that I might be especially helpful in supporting people that present with depression, but I might be less helpful in supporting people with obsessive compulsive disorder, let's say. So it could be a problem-specific deficit that I discover by looking at my own data that in turn informs my professional development plan. I could speak with my clinical supervisor about refining my skills in one area of practice, or I could take professional training courses in that area.